Why aren't women being handed progesterone as they leave the hospital after having a baby? Post-care for a woman who has just carried a baby inside of herself for 9 months and then pushed it out is ice pack, some ibuprofen, maybe some painkiller, and that's it. Oh, and some hemorrhoid pads. Forgot that one. Has anyone ever been told how to repair your insides, how to put your rib cage back together, what to do if your xiphoid process has been broken, how to help your uterus go back in place? Or you're like, oh, you just, breastfeed if you can even do that. And then your body will just figure it out. In your follow-up, they're going to make sure your boobs are working right so your baby can eat. And maybe they'll ask you about your mood, make sure you're not depressed. And if you are, they're going to give you an antidepressant to make sure that you are muted out just enough to stop complaining. Why aren't we given progesterone, the happy hormone that would actually make us feel better? Why aren't we offered pelvic floor therapy? Why aren't we offered any information about how to put our organs back together? Ice baths are a really big thing right now. Seems like it helps with recovery, mood, and also inflammation. Why hasn't that been a recommendation for helping women post-baby to put their bodies back together? Instead of handing women antidepressants, why not give us some hormones and maybe, like a spa membership and a group of friends that can pop over and help us make some dinner and hold our baby while we shower? That would be way better than antidepressants. Why aren't women?
I want you to hear in this woman's voice her frustration, her anger, and I want you to understand that she is not alone. And describing something as amazing as giving birth in those tones is a failure on the part of our medical system. She's right. Not a single word that she's saying there was wrong. And it's pathetic. You were right. You were right. You were so right. I prescribe women progesterone right away, always. I don't know why they don't. We know that most women have postpartum symptoms due to a drop-off in pregnenolone. And there's a medication that is available. Pause. We're going to look it up. I'm going to tell you why they don't use it. One of the reasons why they might not be using progesterone in a woman, when you're pregnant, it goes way high. 200 to 300 you'll see in the final trimester there. And normal cycling will hit 24. So it gets pretty high during your pregnancy. And then it goes to 0 postpartum. Progesterone, as I mentioned in previous podcasts, crosses the blood-brain barrier and it turns to allopregnenolone in the brain. And allopregnenolone is a powerful anti-anxiety agent. So when a woman goes from lots of it to none of it, of course she's going to have mood changes. Of course she feel horrible. It's so common for that to happen. What you saw in that video is it's a crime, I think, in some ways. So why aren't they doing it? Why aren't they giving them progesterone so they can make allopregnenolone? Well, allopregnenolone you can also take as an oral supplement available over the counter. But why aren't they doing it? There's a medication called brexanolone. I believe I'm pronouncing that correctly. It's $34,000 for an IV of it at the hospital. It's a slow drip. And brexanolone is allopregnenolone. And they basically just do a drip into you over a period of time. And that's how they treat postpartum. It's a novel new therapy. It's just giving you allopregnenolone instead of giving you progesterone. You deserve not just progesterone and a spa treatment. You deserve support and care. You deserve your doctor to try and understand you. You deserve your doctor to give you true care. If you're feeling this type of resentment to the medical system, they're not doing a good job at all. That was emotional. I've seen that. I forgot how much that pisses me off. $34,000 for an IV of allopregnenolone. If you have a video on something of this nature or something that has impacted you, please send it to me. DM it to me on Instagram, and I'll try and use it. Thank you for tuning in.